If you'd rather contact us separately, you can do that via the Healthy Brum email address, which will be shared at the end as well. So, Ibrahim, please could we start the recording for the webinar?
It's started now.
Okay, thank you. Hi everybody and welcome. This is our Getting Mind Ready webinar of the Be Healthy webinar series. This is a fantastic webinar with a really good lineup of people that have come to talk to us about getting your mind ready and how we can best mentally prepare for whatever COVID-19 and the winter months have prepared for us. So as you can see on the slide today, we have Andy Bell with us, who's the Deputy Director for the Centre for Mental Health. We have Helen Wadley, who's the CEO from Birmingham Mind. We have Laura Roden, from the Service Manager from Pause and Forward Thinking Birmingham. And we have Anju, who's the Culture Change Manager for the HR and Occupational Development Department at Birmingham City Council. The webinar is an hour long. Sorry. So just before we get started, some housekeeping. So if you could, when you're not speaking, if you could turn off your camera and stay muted, it just helps us with the flow of the webinar and the bandwidth. Equally, if you have a VPN, so maybe NetMotion or Cisco on your computer, we're finding it's working better if you turn it off at the moment, and that all just helps to save bandwidth. We encourage questions though, so if something springs to mind during the presentations, just type a question in the chat and we'll pick it up or bring you in to ask that question at an appropriate pause through the webinar. If you have a question and you'd rather not ask it in front of everybody else, feel free to email to healthybrum@birmingham.gov.uk too. And as we've already said, today's webinar is recorded and will be used as a resource for people to share with people and to share with people that couldn't be here today. Following the webinar, all of the recordings are on the Birmingham City Council website alongside the Be Healthy booking links. So I've mentioned Be Healthy a few times and you're all here for Getting Mind Ready. Getting Mind Ready is part of our Be Healthy work. So Be Healthy is a series of practical resources to help leaders and professionals with direct access to communities to support their communities to reduce the risk of becoming seriously ill from COVID-19. So we have a webinar series with 16 webinars, some around COVID safety, so self-isolation messaging, testing messages. We have the one around mental health today, so getting your mind ready. We also look at smoking, physical activity and healthy eating and sleep at the end of the series. So there's lots of useful webinars to listen to with lots of good tips and advice and guidance that you can share with your communities. Alongside the webinars, we also have a handy resource, so a checklist for a healthier you. That is a tool that you can use with communities that runs through all of the webinar series really. It's a checklist where you can check that you're doing as much as you can to help yourself to be as healthy as you can. And you can use it with members of your family and the community too. So all of those resources and the webinar bookings can be found at the Birmingham City Council website. The address is just on the slide below. All of those Be Healthy webinar resources are also translated as well, so there's lots of different languages available to download from there. So moving on to today's webinar and content, our first speaker is Andy Bell, who's from the Centre for Mental Health. He's going to give us an overview of mental health during COVID-19. It's a really interesting and relevant presentation, so I hope you will enjoy it. Over to you, Andy.
Thanks very much, Stacey, and thanks for asking me to be part of this today. I hope it's interesting. We'll find out, won't we, in about 15 minutes' time. So Centre for Mental Health, if you don't know us, we're an independent national organisation. We work across the country to really look at inequalities in mental health and both what promotes good mental health for all of us, but also what supports the lives of people living with mental health difficulties. And throughout the last 6 months, we've been focusing on the impact of COVID-19 on mental health and also the lives of people with mental illness to make sure that we're able to identify issues and concerns, support decision making, and help people both locally and nationally to know how to use the evidence to hopefully make a difference in communities. So what I'm going to do is share very quickly some of the evidence that we've amassed already. It's not all of it, but hopefully it will give you some kind of idea of where we are. So the first important thing to say, and it's a bit of a cliche, but we say it all the time, is we all have mental health. Mental health isn't about either having or not having a mental illness. We're all somewhere on a spectrum, and all of our mental health will be somewhere on here. I hope as many people as possible on this webinar are kind of in the green or maybe yellow on this spectrum, but we won't all be. And at any one time, about 1 in 4 of us are in the red or maybe orange here in this spectrum. And over the course of our lives, about 3/4 of us will experience poor mental health. And crucially, the things that determine our mental health are about either the risks we encounter or the things that help protect us from poor mental health, or indeed promote good mental health that we experience for all the way through our lives, from pregnancy through to end of life. So it's very much something determined by the society we live in and our position within it and our experiences of it. Next slide, please. So inevitably, we've wanted to look at what impact COVID-19 will have on mental health, because it's clearly very serious, and I'll come on to some ways in which that's the case. But just looking at the evidence so far, the headlines really are that every survey that's gone out has suggested that there has been a sharp rise in what we might call emotional distress. So that's not necessarily mental illness, it's not necessarily having a condition, it's having your well-being worse. For some people, undoubtedly well-being has got better during that time for a variety of reasons, but on the whole, for more people, well-being has got worse rather than better over the last 6 months, and it got particularly bad at the beginning of the crisis. What we've also seen in countries that have been dealing with this for longer is that for many people, that early poor mental health has crystallized into mental health problems, particularly anxiety and depression, and in some cases post-trauma symptoms. And indeed, for some people, using coping mechanisms such as alcohol or drugs, which might be regarded, or indeed are, unhealthy. I think what we also know, and we're seeing very, very clearly, is for people who already have poor mental health, and remember that's 1 in 4 of us already, things seem to have got worse in particular, and for some groups of people, very particular challenges. Next, please. So one of the things that's become really apparent to us is that we need to use an understanding of trauma to really understand COVID-19, because in some ways this is a trauma that's happening to all of us. Every single one of us is affected in some way, shape or form by it, and it's a traumatic event. It's a kind of slow running trauma, but the reality is we're not all experiencing it in the same ways, are we? We're not all quite in the same boat, in the same storm, to use a metaphor I've seen. And what we can say really clearly is that this is highly unequal. And some groups of people are particularly affected by the traumatic nature of this. That includes those who've been most affected by the virus, people, for example, who received hospital treatment for it, or sadly been bereaved during this time, very clearly affected in a very traumatic way. People who have been affected badly by the lockdown, for example, anyone who is in a home where they aren't safe. And of course, people affected by the recession. And I know that the Chancellor is speaking while we're doing this about what he's going to do this winter to help protect us. But I think what is very clear is that the effects of the economic downturn may affect more people than the virus itself longer term in terms of our mental health. And what we also know, because this is a traumatic event, is that if you've had traumatic events already in your life, this may make it worse still. So, for example, someone who has a trauma relating to abuse and violence at home, if they're then stuck at home for longer, it really brings that back to them. Next slide, please. The inequalities we're seeing are affecting a wide range of groups of people. So one thing that's become very, very clear is, from surveys in particular, is that for children, young people and young adults, the effects of being cooped up at home are undoubtedly greater psychologically. Again, these are all on average. People living with long-term conditions, those who were told to shield over the spring or told to take extra care, and living in genuine fear of their lives. That has a really wearing away effect on your mental health as well as physical. People from oppressed and disadvantaged, racialized communities, there's unquestionably a greater impact. And many of the risks we see relating to the virus, the causes of it, being on a low income, being in high risk occupations, being in overcrowded housing and workplaces, these are things that affect mental health too. People with poor mental health already, we've seen particularly examples of folk who are not able to get access to food and medicines during this time. living with quite serious mental health problems. People whose livelihoods are most precarious, certainly older people, especially those living in care homes, of course, given the risks they're experiencing, and also people in prison. In many prisons, people have been confined to their cells for 23 hours a day. That is very important to keep them safe, but it also creates a huge psychological effect. Next slide, please. So here's a graph. We've all seen the graphs relating to COVID, haven't we? And it goes up and down, and now it's going up again. A few months ago, we decided to look at how that compares with mental health need. And what we've seen is that as COVID went up, the need for mental health support, the levels of poor mental health in the population went up. And as COVID went down, the mental health need is still there because a lot of these needs are still unresolved. And I'll come back to what the future looks like in just a moment. Next slide, please. So one of the things we've heard endlessly is this notion there's going to be a tsunami of mental health need, a sudden tidal wave of people asking for help. And there are some reasons to think that. We think that at least 500,000 more people than will experience a mental health problem this year than would have done if this hadn't happened. We also know that people living with mental health problems may need more help. And of course, people didn't necessarily ask for help for their mental health during lockdown. So you've got what you call suppressed demand, people who haven't gone for help but have needed it. But the reality is this won't all happen suddenly, or it certainly won't happen to the NHS suddenly, because we know that many people take a long time to ask for help for their mental health, don't necessarily feel it's okay to ask, or don't know how to ask. And we know the economic effects may take quite a long time to really start to affect people's mental health. Next, please. Worryingly, as we go into a second wave, all of the evidence suggests that mental health needs will go up and up the more waves we have. And so that's one reason for trying to do everything we can to suppress the virus, because that will suppress the amount of psychological harm, as well, of course, as the huge physical harm it does. Next, please. And crucially, we need to be really aware of this winter. We've got potentially a coincidence of 4 things all coming together. There won't be the furlough scheme, though clearly today there may be something to come in its place. We could have seasonal flu. We're clearly going to have COVID-19, and we will of course have the economic effects of Brexit. That could affect the entire economy and therefore many more people's livelihoods as well as their lives and their mental health. We need to be really attuned to that risk. But just to focus on some positives, there are things we can do to help. Yes, next slide, please. Thank you. We need to make sure those financial safety nets are there, particularly for the most vulnerable. And that includes things like not putting people who are on out of work benefits on conditions or sanctions. It includes making sure people have access to food and income. We need to help schools, colleges and workplaces to create spaces that are safe psychologically as well as physically, trauma-informed spaces as we call it. We need to have really good employment support, particularly for young people and millennials for whom unemployment at a young age can be particularly damaging to mental health. We need to make the criminal justice system, particularly prisons, safer. And we need to make sure that people who have ongoing mental health needs get help with their physical health and with money and food. Next, please. So we published something today we're really proud of, looking at how workplaces can be trauma-informed. And some of the principles we see there are about having an open and supportive culture, being able to talk about mental health, having regular signposting to specialist support for people who might need it, having line managers who get and talk openly about mental health and can help people who need it, having flexible policies. We've seen some companies that have extended their bereavement leave, for example, and others who have made it easier not to return to the office or the workplace if they don't feel safe. And particularly support for young workers and staff from the communities that have been particularly badly affected over this time. Next, please. Nearly there, you'll be pleased to know. We also need to make sure, of course, that health services are there for people who need it, and particularly being mindful of those groups either who face a very particular risk and going out and offering help, for example, to people who've been bereaved, and targeting help where it's most needed. Next, please. And we need to be aware that this is going to get serious, and it could be a very large proportion of the population who are affected, particularly by depression, anxiety, and post-traumatic stress disorder, PTSD. Next slide, please. here are some resources we've produced. Hopefully you'll get the slides and the web links afterwards. If not, I'll post them in the chat. And I'm happy to answer any questions about anything after other folk have spoken. Thanks for listening.
Thank you, Andy. That was brilliant and really interesting as well. And hopefully it set the scene and helps everybody to understand exactly the mental health situation that we're in and what we have over the coming months potentially. So I'm going to hand over next to Helen. So Helen's the Chief Executive Officer from Birmingham Mind. She's going to talk about resources that Birmingham Mind have available to support communities and workplaces in Birmingham, predominantly for those that are 18 plus. So Helen, over to you.
Thank you, Stacey. It's always a hard act to follow, Andy, and it's nice to see that we've got a couple of slides which virtually look identical, so we'll be able to quickly skim over those. So as Stacey says, I'm going to talk a bit about what is available in Birmingham really to help both individuals but also help communities, groups, employers around really supporting people to become mind ready for what is going to be a difficult winter ahead for us. So just a bit about what Birmingham Mind does. So we provide a range of services which go from 24/7 accommodation services all the way through to our prevention services such as our community development workers and the helpline. And the helpline is one of the areas that I'll be particularly talking about today. So just some sort of stats about the numbers of people that we generally come into contact with, and we expect, as Andy says, that the need will just increase and we will have more demand that are coming through. Next slide, please. So what resources are available? Just to, next slide please. Just to recap on Andy's Continuum, mine's slightly different, not quite as colourful as Andy's, but it is just that real emphasis about that we are all on a mental health continuum, and we will move up and down that continuum at various points during our lives. And in general, what we've seen in the pandemic is almost that most people have sort of shifted along one section of the continuum and are in general experiencing poorer mental health, and a number of studies to show that. But what actually makes mental health poorer is very much the health inequalities, things like the unemployment, poverty, access to food and medication, as Andy has said. Next slide, please. So why is it important that we start having those conversations with our communities and with our workplaces? The more we talk about mental health, the easier it is for people to say, I'm struggling, can I help? Can I have some help? What, can you do something for me? But actually, when you are struggling, all of your resources are tended to sort of go on holding it together, and it can be really difficult to open up. So actually, we encourage people to be really persistent in a nice way, of course, around saying to people, it's okay to talk to me about your mental health. It's okay to talk to me about your struggles. And it's very much as well then knowing about what is available for us then to be able to point people in the direction of getting more help when actually if someone's talking to us about their mental health and we're starting to feel out of our depth about it, about where we can signpost people to in the system. Next slide, please. So at the beginning of COVID, we worked with our NHS commissioners, the 2 mental health trusts in Birmingham and other third sector organisations to really try and create a sort of one-stop shop for mental health and wellbeing support in Birmingham and Solihull that would be available 24 hours a day. And it has been a rapid development of this service, but I think it's a really exciting and a timely way of just trying to make it much easier about getting the message out about how to get mental health and how to get support with your well-being. Next slide, please. So Birmingham Mind operates the helpline between 9 AM and 11 PM 7 days a week, and then after that time at 11 PM it defaults to the 2 mental health trusts. We've got the Adult Mental Health Trust and the Children's Under 25s Mental Health Trust within Birmingham. And what people are able to get from the helpline is really the full range of support around mental health. So we never say to people, you've come to the wrong place. It is very much about actually what can we offer to you to help you and the circumstances that you're in. So from the sort of general wellbeing advice and guidance, and we've got access to the national mind literature, which is brilliant, as well as our own local mind literature that we can send out. Signposting to other organisations, but being a bit more than a signposting. There's nothing worse is that ringing up a number and being told, oh, here's another number. So it's not like that within the helpline, but obviously there might be other organisations that might help to offer you a bit more support and guidance, say if you're needing support around employment or a particular issue. Birmingham Mind is funded by Birmingham City Council to run a range of online being well courses, which I'll come back to. And through the helpline, people can get access to the full range of psychological interventions. And this is sort of short-term psychological interventions to longer term. And I think it's really important that, people will have heard about long waits, trying to get through to talking therapies and things. In Birmingham at the moment, most of the therapeutic organisations are able to turn around referrals within 48 hours and certainly within a week. So, we really encourage people to pick up the phone and seek that help because it is available. We have got it at the moment. If someone's needs are such that actually we feel that they need a bit more of a clinical input, then we do have strong links with the mental health services that we can refer people into and work with the mental health trust around what support the person might need from them, but also what else we could offer through the helpline. And as of next week, on a Thursday and a Saturday night, we'll also be offering physical face-to-face sessions, crisis sessions for people who are really struggling and just, want more than a phone line and want to be able to sit down with someone and have a conversation. And we've also obviously got access to other more specialist services, as I've said. Next slide, please. So how people can access the helpline: telephone number, so 0121 262 3555. It's always a worry when you're doing a presentation that you're going to put the wrong phone number down. Glad that I've got it right. We've also got a multilingual live chat, which is limited hours at the moment and can be accessed via the Birmingham Mind website, and it will tell you when that's available, or email. And obviously the helpline uses interpreters as and when it is needed. Next slide, please. Mentioned about the Being Well courses. So we've got some online courses that we're encouraging people to sign up to at the moment. Most of them are 4 weeks long, once a week, but we do have some one-off sessions as well. So we've got mindfulness, building resilience and coping in times of coronavirus, which are all open to take bookings for at the moment, and they can be accessed via the helpline. But we will be having more courses as time goes on as well. Next slide, please. If people are ringing us up and they've already sort of got an existing mental health issue and are wanting to understand what is available for them in Birmingham, then we've got a wide range of services, both delivered by Birmingham Mind and also delivered by other organisations, which we can signpost people to. So it is very much that the helpline being that one-stop shop. And we've got local bereavement services which are coordinated by Cruise Birmingham. And I'll realise I hadn't put the telephone number on, and I'll put it in the chat function at the end of this. And again, specialist bereavement services that have been set up because of COVID, so please do use them and let people know that they're available. Next slide, please. Where else can people get more information from? There's a wealth of information about mental health on the web, but I'd really encourage both you and the people that you work with to only really go for the sort of main websites. There's an awful lot of misinformation and scary information around, so please do stick to the national and local websites. And in terms of that, I would always encourage people in Birmingham to go to the waiting room. Next slide, please. So the waiting room is Birmingham based, and it's effectively the one-stop shop online. So you go into the waiting room and there are lots of resources and links to other organisations on both a local level and on a national level around issues such as employment, domestic abuse, obviously mental health, addiction, etc. Run by Birmingham Third Sector organisation, and it's a really great resource, and they have fancy apps and QR codes and things like that, which I have to say it's slightly beyond me. But I think Karen and maybe Terry are on this call, so they're much, as the people who run this service, they'll be much more able to describe it in terms of the app side. Next slide, please. So about local campaigns and sort of thinking about those sort of workplaces and those groups, what is available to help support people on a more sort of group level. Next slide, please. So there's a couple of large, again, very local campaigns. So there's one called the This Is Me campaign, which is within the West Midlands, and it's very much around challenging stigma of mental health in workplaces. So workplaces sign up to it formally, and then they get some support. And in essence, it's about making short videos of people talking about their mental health and talking about mental health in the workplace, and then that's shared, and it's demonstrated that it has a significant increase in terms of people coping within that organisation and people being open about their own mental health. So it's definitely worth having a look at. Next slide, please. We also are very lucky in Birmingham to have a Time to Change Birmingham hub. So the Time to Change campaign is again around stigma and discrimination. People with mental health issues, one of the main reasons why people struggle to come forward is around the stigma and discrimination. So actually work to reduce that, particularly in some local communities, but also in general, obviously is really important so that people can reach out and ask for help. Oh, I see Terry's in the chat, done the link to the waiting room. Thank you, Terry. Other options that are available, so for groups and organisations, I would really recommend, particularly if you're coordinating a community group and there's volunteers, etc., that people do the COVID psychological first aid course, which has been developed by Public Health England. It's a great online course that just takes you through what are the important things to think about when you're talking to someone who is living through the effects of the pandemic, as we all are. It's a really great and free resource that I can't recommend highly enough. And for workplaces as well, there's a Samaritans active listening video, which again I recommend, well, about encouraging, supporting all of us to be able to have conversations with people that might be struggling with their mental health. Next slide, please. there's more formal training then that is available. So there's something called mental health first aid, which is an accredited qualification, and you can become a mental health first aider, and very much we're sort of pushing at a national level that, you know, all companies should have mental health first aiders in the same way that you've got physical first aiders within companies. And it takes you through all of the different types of mental health, but importantly, it enables people to feel more comfortable and confident about supporting people with mental health issues. And again, that crucial point about knowing when to refer someone on and not feeling that you have to take on someone else's problems yourself. There's lots of other training that are around that is being delivered by both ourselves and other third sector organisations, Cruise, Common Unity. So there's a lot available that Birmingham groups can tap into. Next slide, please. The 5 ways to wellbeing has been around a bit now, but I still like it because I think it's quite a nice, simple way for both ourselves and for groups that we might be supporting to do almost sort of like a bit of a wellness check-in. So are we doing the things that we need to do in order to have positive mental health, to sort of like help store up the resilience that we're all going to need for the winter. And it's very simple. Again, it's about ensuring that we've got connections, whether that be through friends or family, or our links within community groups, and just making sure that everyone has got someone that they know that they can turn to. Being active, you know, as proved with the lockdown, you don't need to go to fancy gyms and pay money. Birmingham has got some absolutely fantastic parks, and it's got some open air gyms as well. So it's, you know, there was a lot of resources around. Giving, it's really important for our own resilience to actually feel that we're supporting other people, that we're being able to give back. So, you know, there's the COVID Community Champion scheme and other volunteering that is around and available to do. Learning really helps stimulate our minds, and actually, again, that shows that it's around mental resilience, and that taking notice, being really in the present time, really, and thinking about it. And just being aware as well about the fantastic architecture that there is in Birmingham as well, and just taking real notice rather than hurrying along the street trying to sort of, you know, get to wherever we need to go as quickly as possible. Next slide, please. So there's lots of resources that are available, you know, and people can get lost in it. So I think that's why sort of trying to keep it actually quite simple today, and it's the online portal is the waiting room, and then the mental health helpline, and we can help support people and navigate through what is available, and what support someone might need. So I thought it'd be easier to do that than to try and give you a complete overview of every resource in Birmingham, because, you know, I get lost in it, never mind people that are not working within the mental health sphere. Next slide, please. And so just to finish, if you're concerned about your mental well-being, whether it be that you're just starting to feel anxious or actually you've got mental health diagnosis, illness, and that you're wanting to have some extra help for, then please do ring us. Thank you.
Thank you, Helen. Thank you. That's a great presentation again, and it's so reassuring to see how much support there is available to people in Birmingham. And I echo Helen's comments about the waiting room. It's a really good place to signpost people to, and yeah, the mental health line there is great to pass on to yourself, your friends, your family, and people in the communities. That's great. I've seen a couple of comments pop into the chat. We'll pick them up at the end. Thank you, though, keep them coming on in. So next, can I hand over to Laura? Laura, are you here?
I am here, thanks, Stacey.
Hi, Laura.
Hiya.
So Laura's here from Pause, Forward Thinking Birmingham, and she's today going to talk about what's available for young people in terms of mental health resource. So Laura, I'll hand over to you and you can explain all. Thank you.
Thank you. Hi everyone, I hope you're okay. It's hard at the moment, isn't it? And I think that's really an important question and a statement to make, and to check that everyone's all right is something that we're doing constantly. And hearing the two speakers earlier and Stacey talk already, I know that I'm already thinking, wow, we've already been through so much and yet we've got winter to come. And what I'm just wanted to reflect with everybody is it's an ace that you're on the call, because it means that you're active and that you're wanting to help, but also remembering to reflect that you're doing a good job, because the fact that you're here is ace, and the fact that you're finding out about these resources is brilliant, and everything you're doing is really helpful and really useful, not just for yourself but for the people around you, and sometimes it can feel a little overwhelming, but I just wanted to say welcome and thank you. So my job, as Stacey said, is I'm the service manager for Pause, which is an early help, low level support for young people and their parents within the city of Birmingham around mental health. I'm employed by the Children's Society, which is a charity, but we are commissioned and part of Forward Thinking Birmingham, which is the child's and young person's mental health service for the city. So we're linked in there. And I'm going to talk for a little time about what's available for children, young people and families in the city, as Stacey said. But I wanted to really start with thinking about why and how we define emotional kind of healthiness. I think we all think about, you know, eating apples and going for a walk and stuff being physically healthy, but maybe it's quite hard to define, hard to talk about. And the services that I'm going to talk about in a moment, not just my own, but the other ones that are available in the city that I'm going to point you to, are really there to help when we feel that we're not as emotionally healthy as we could be as children and young people. But sometimes asking that question and signposting a child or a young person to a service can be hard to start that conversation. So I thought I'd frame it a little bit with these things. So I feel we're emotionally healthy when we function in society, which is a big way of saying we feel all right and we feel like we're getting on okay, whether it's in nursery, in school, in college, in uni, or just in the workplace, but also when we're with our family and friends. And at the moment, a lot of people are functioning in one or a couple of those spheres, but maybe not all. So some of them, you know, might be okay when they're in their workspace and they've got structure, but not really engaging with their friends anymore, might have lent back, or you may be throwing yourself into your schoolwork, but not actually able to sit down and eat with your family anymore. It's not feeling good. So these are kind of signs and signals that might not be working. Coping with life's challenges. It general in life for children and young people, that can be hard, especially for teenagers, but these things are hard at any point in our journey through life. But using our strengths and building on those to cope is a sign that you're emotionally healthy. And if you're struggling with that, that means that maybe we may need to reach out for some help. Understanding and managing our emotions, incredibly difficult, and kind of as you grow and your child develops, or you develop as a young person, your emotions change, and it's important that you know how to handle them and how to then express them. Sometimes we know how to recognize them, but we don't know how to express them, or express them in a healthy way. So that's another way that you can explain it. And also having some self-acceptance and some acceptance of other people. Those are other ways that we show our kind of emotional healthiness. And these are things that we can support and help with, and the other services can. And the reason that I've put them all in there is because what we are finding as a service, although we are in the midst of COVID, and that is what we're talking about 50% of the children and young people and families that we're talking to are actually still talking about just life stuff, because life hasn't stopped, and because real things are happening to people. And as you know, the speakers earlier said, not just COVID, there are other things happening with work and Brexit and all these other big looming things, but there's also the kind of more everyday relationships, or family troubles, or stresses about school. I will, don't worry, thanks Anju, that make things hard. So it is very much making sure that you know how to talk about emotional health. So if I can have the next slide, please. The first thing I would like to kind of bring your attention to, you may have seen this blue banner in the city, around the city, and in schools and unis that you've seen. So this is the first place I'd like to signpost all your organisations to, whether you're an employer, a community organisation, because you will all know a parent or a child, I assume. And this is a place where we've collated all of the resources around supporting pupils, parents, carers and educational professionals, but also adults in how to support children and young people back to school. Emotionally based school avoidance is a fancy way of going, they're not able to get into school. And we understand why. There's been a big gap, but actually a lot of anxiety and a lot of stress for families about returning to school because of the changes and because of the new COVID way of working there. For a lot of children, that's become difficult. But not just anxiety resources on there, there are also resources on low mood, there are also resources on kind of panic and anger, and there are ways for yourselves to feel a bit more educated in understanding what these behaviours are and how to manage them, but also how to communicate with your child, or for people to communicate with their children about this. So that's my first place to say, go there, look at those resources. There are videos to explain some of the techniques and offers there, and that can really help families to feel a little more settled in understanding what offers are available. If I can have the next slide, please, Anju, that'd be amazing. So the second place I'd like to make you guys aware of is a service called Couth. They're an ACE service that's come into the city recently, and they are an online kind of emotional wellbeing platform for children and young people 11 to 25 in Birmingham. It's free and it's safe and it's anonymous. So they have access to a number of different platforms on there, including chats to professional counsellors, so an online chat function with professional safe people. And for a lot of young people, talking to a grown-up is what they want, and that's what my service offers. But a lot of other young people, that can be a very, very difficult step, and this is a great first step to go into a space where it's peer support is available, but that's all moderated, so there's an adult making sure that the content is appropriate, but that they know that this is a safe space to share, and they can get the relevant guidance to then go to the services that they need to, or it may just be encouraging them to talk to their parents or their family. So I would recommend Couth. I think it's a really great website, and I would just send it out there, and young people will use it, log in and sign up and have that, and they can use that at any time, which is a brilliant resource. And then the next slide, please. Thank you. So Pause is what I do and what I manage, and we are there to help with anything relating to emotional well-being. So as that's one of the reasons why I went over it at the start. We're there for anything. You don't need to have been referred by a GP. You don't need to kind of have any concerns that you've got a mental health illness. This is about talking about your emotional well-being, and it's for any young person up to the age of 25 who is registered with a Birmingham GP, or for their parents and carers to talk about their child. So I make that distinction because we do not offer services for people over 25, but we do offer services for parents and carers who are talking about their child who is under 25 years old. We are a service that isn't anonymous, so the child and family do need to register with us, similar to when you have to sign up to your GP, but then you would have that opportunity to speak with a trained professional about what's going on. So what I really love about Couth and Pause is that between us, you've got those two offers. Couth is anonymous and online, and young people can just go on there, and with us, we can be registered, we know who you are, and we can do that more kind of direct work, but also speaking to a human who you could either see on a video call or speak to on a phone call. We are there to build resilience. So a young person would register with our service, and then because we are young person led, we will wait for them to contact us to then want to talk about whatever it is that's bothering them, whether it is, I'm a bit stressed because I've been given homework for the first time in 6 months and this is what do I do? Or that that it's too much and I just need to talk. We can't diagnose, we can't kind of give an assessment or a criteria, but we can pass people on to the next relevant service as appropriate. So just to summarize, we have Couth, we have #You'veBeenMissed, and we have Pause. All those services are available throughout Birmingham.
Thank you, Laura. I can't get to unmute quick enough. Again, that's really, really interesting, and so many good resources available for young people across Birmingham. So whether it be You've Been Missed, Couth, or the pause services themselves, so much out there. So thank you very much. And next, handing over to Anju. Anju, are you with us? She's going to talk about getting your mind ready in the workplace.
Thanks very much, Stacey, and thank you to Andy, Helen and Laura for some great presentations there. So I'm Anju Dhir. I work for Birmingham City Council. I'm lead on employee health and wellbeing. I'm here to talk to you about how your organisation, through the lens of Birmingham City Council, can support employees' health and wellbeing, and that you may want to adopt a few things in your workplace. It's true to say that the impact of lockdown has been really profound. Our internal health and wellbeing survey that we carried out within the council has identified that staff have really been tested during these times, from being working carers, from our financial wellbeing, feeling isolated, working and looking after children at the same time, and feeling kind of anxiety from the unknown. So we have a real opportunity to be intentional and preventative about making improvements to employees' health and wellbeing. Thanks, Stacey. So within the council, we have many back office and frontline colleagues providing services to citizens and service users. And during the pandemic, we've produced a number of regular documents, advice and general guidance for staff on how to access resources, just as the other presenters have outlined, to support themselves not only in work, but also at home. And I suppose the focus of the next few slides is to highlight, just really in summary form, what resources there are for frontline workers. So for example, the Department of Health and Social Care have got a free app for adult social care workforce, and they can access that anytime, anywhere. And also there's advice for managers and teams checking with each other regularly, and also be really intentional about popping on your video and having a conversation face to face, because there's obviously difficulties in doing that in the workplace. Thank you, Stacey. The Local Government Association have also produced a lot of advice for frontline workers, and again for line managers supporting their teams, and in particular developing that emotional resilience and wellbeing in light of the pandemic. And if you just pop onto the next slide, there's more resources as well from the LGA as to what's available. I mean, these slides will be available to you after the presentation, so you'll be able to click on the links. And if you just look on the next slide, there's some really useful information from the NHS in relation to kind of 8 exercises you can carry out to support and combat high anxiety, fatigue. They've got really good tutorials and recorded exercises for staff. So for example, they've got notice 5 things, an exercise that can really centre yourself when you're getting caught up with kind of intrusive thoughts, and then breathing exercises and deep relaxation muscle techniques. On the next slide, we can see that we talk about resilience, but it's an opportunity to really figure out, well, what is a resilient person look like, and what do they have, and what is it that we can do in a kind of a step-by-step approach to improve ourselves and in kind of coping with what's coming, as Andy's highlighted. Resilience is the ability to bounce back from certain adversities, and many factors can shape our personal resilience, including our personality, our past experiences, and our current circumstances and what we're experiencing. And everyone has resilience, but people may have qualities that make them more resilient than others. So you'll see the picture on the right, some of these qualities include visualizing success. So what are your goals, and are they stretch goals? Boosting your self-esteem. Someone gives you a compliment or a praise, smile and say thank you. Becoming more optimistic and looking at the brighter side of certain situations. Managing stress. Stress is good for us. Some of it is, but actually prolonged stress is not. So if you constantly feel overwhelmed, then you may physically see and feel differences in your body. And I find the Wellness Action Plan on Mind's website a really good tool to help understand my mental health more. You may want to kind of improve your decision making. Resilient people make more decisions rather than avoiding them. And asking for help. There's plenty of support that's we've highlighted in today's presentations, but making sure that there's nothing wrong with asking for help. And if even that's with someone who you trust as a family member or friend, a mentor or a coach, someone that you can have those initial conversations with is a real positive first step. And then also just knowing and being yourself. What are your core values and how can they help you kind of to cope with challenges that we face? On the next slide, you'll see that within Birmingham City Council, we provide the 4 pillars of support. So this is internal support offered to Birmingham City Council employees. That's free for them because we want our staff to function well at work. We appreciate life sometimes takes over and we may not be as productive as we want to be. So the first pillar is the Employee Assistance Programme. We buy this in and it's free confidential support 24/7. And it's an opportunity to talk to people about our low mood, mental health support, bereavement and financial wellbeing. We also have an online presence as well, so you can access podcasts, etc. We have mental health first aiders, and as Helen's mentioned before, that they're a really great resource. Just as you would have physical first aiders in the workplace, mental health first aiders are there kind of as initial support to listen and signpost towards support that person it may need to access. And we're finding that they're a really great resource, but understanding they're not counsellors. We have our in-house occupational health service, which is CQOSH accredited, and that there's a number of services that staff can access through their line manager referral. And then finally, we have our chaplains, which again, external support that's brought in for anyone of any or no faith. They can provide that confidential, private support, and it's not only for individuals, but also they offer team-based support. So if there's a manager who's not really confident in having a conversation with their group of staff about a particular topic, about their own health and wellbeing, then the chaplains can help provide that kind of facilitative support within groups. And they also provide mindfulness sessions for staff 4 days a week. So I suppose in your organisation, find out what help is available for you to access for free. We've got some kind of slides further on about the resources from external agencies that can help support in different circumstances. So for example, bereavement support, we provided colleagues with a list of companies that could help with bereavement, with domestic abuse, with mental health, financial wellbeing. And like I said, they'll be available for you afterwards. But other changes you may want to make in your organisation could be setting up an internal storytelling event, sharing how you're feeling during the pandemic. The CEO or senior leader or manager may want to introduce the event to show commitment to it. And on the 10th of October, it's World Mental Health Awareness Day, so you could tie it in with a national calendar event as well. You can do one-word check-ins in meetings, so it's a great way to share to your colleagues how you're feeling during the day, because it does definitely change. So before you start your meeting agenda, you can actually just have a one-word check-in whether you're feeling frustrated or anxious, and it gives an opportunity for people to understand where you're coming from. And you may want to share some of the resources that we've identified in today's presentation to kind of help people realise that actually there's a lot of support out there. What we use in Birmingham City Council is West Midlands Combined Authorities Thrive at Work framework. And we found it's a really good starting point to understand what it is as an organisation we can do to support the health and wellbeing of our employees. We have a legal duty to do so, but also it's the right thing to do. And it starts off by saying, carry out an internal survey, which can be anonymised, really listen to your colleagues, then also analyse your sickness absence data, and then what actions can you put in place thereafter. So I hope you found that useful, and I'm happy to take any questions as with everyone else. Thank you.
Thank you, Anju. That was really useful, and the third perspective to kind of, we've talked about young people, we've talked about adults, and that's about in the workplace. So really helpful. Thank you. So as Anju said, in the slide pack, we're not going to go through these slides today, but there's lots of other support and links that will be available, and we'll make sure everybody has the slide deck afterwards. So for those of you who've been to some of our other webinars, you might be familiar with the theme of this discussion. So if you have any thoughts about how you can use these resources to support communities with their mental health, then please start dropping them in the chat now. Equally, if you've got any questions for any of the speakers, please do the same. I'm just having a look through the chat, the questions that have been raised so far. So yeah, Andy's posted the resources that he promised, so that's great, thank you. And the waiting room link is there too for everybody to have a look at. And we had, yeah, I think most of those questions have been answered in the chat. The bereavement services helpline is there as well. I'll just read it out in case anybody listens to it afterwards so they see it. So the Birmingham Bereavement Services helpline is 0808 808 1677. I don't think there's any questions coming in, so I'll keep moving on, and I'll keep an eye on the chat. So if things do come in, I think everyone's just so impressed with all of the help and advice that's there, that they have all the questions are answered, and they just want to go and have a look and see what's there. So no question from Family Pit, just a comment that this has been one of the most useful seminars in your series today. No, that's great, thank you. And thank you to everyone who's presented, because it has been really, really enlightening and useful, hopefully, for everybody involved and everybody who's going to watch it afterwards. No, that's great, thank you. So as we've had in the other ones, we have the Be Healthy pledge, so you can support what you're going to do, spread the word about Be Healthy and which communities you're going to work with, which in particular is really useful because we can flag if there's any communities we're not reaching with this work and these messaging. This also links into the newly launched COVID champions work as well. So if you haven't seen, we're looking for COVID champions in each of the, well, as many COVID champions as possible in communities across Birmingham and workplaces, and they can be people that we have a direct contact with that can feed out correct, right messaging to spread about COVID and help spread the network and the word. So, like with all the other webinars, the handouts can be found on the website on the first address, and you can also book the future webinars there too. If you have any general inquiries or if there's anything you'd like to ask, the Healthy Brum email is there, and if there are any COVID related inquiries, the COVID email address is there too. So I think that's all from me today, or from all of us, and a big thank you to Andy, Helen, Laura and Anju for joining us and sharing so much good information. Thank you everybody, and I'm sure I'll see some of you on the next webinar. Bye everyone. Is Claudette still there? Just seen her question.
Yes, she's still there.
Claudette has just asked, I think probably the people that you're going to ask the question to have probably just left, but just concerned that waiting times for young people who experienced DVA, women signposted from PAWS and found that organisations for deeper psychological help had like 24 weeks waiting times. Any ideas? I don't, but we can. I can forward that question and get back to you, Claudette. I'm sorry I didn't see it before I kind of wrapped up. So hopefully that's okay. And we'll get your email address from your booking for the webinar and get back to you. Okay, thank you. Okay, thank you. Do you want to stop the recording, Ibrahim, if you haven't already?